Welcome to North of 60. I'm Heidi Schweighofer. Today, my guest is Chris Greider. Chris is a pharmacy manager at Mark's down in the Akron area. He went to Neomed for his education and has been a pharmacist for 5 years. One of the topics that is always top in my mind for my husband and for myself is drug interactions with food, with other drugs, and that's what we're going to talk about today. So first, though, I want to ask Chris, how'd you start in pharmacy?
So it's funny you should mention that, Heidi. So originally, a lot of people, like me, any young person, when we go through high school, you're trying to figure out what we want to do. It happened that somebody was a pharmacy recruiter at the time for the University of Toledo, because that's where I originally started with all my schooling. And it was funny because she came in and she talked to us about being a pharmacist and the advantages of being a pharmacist. Now, the funny thing about that was she made it seem like it was almost like being like a spy. Like you felt like a James Bond almost. And it was like, you have to solve all these problems and figure these things out. And I was like, man, this just sounds great. You almost sound like a detective. So I jokingly say I may have been slightly conned into going into the pharmacy school, but I did love math. I did love science growing up.
Good for you.
The nice thing with being a pharmacist now is that you don't need to have like the extensive, like as I always said, like I took calculus in high school. I can't safely say I've ever used calculus in my life for this.
Good.
So yeah, it's for anybody that would ever have been interested, like it's not anything you have to panic about. But like chemistry is a big part of it because there's a lot of chemical interactions, a lot of things that we have to look at to make sure that things are going well. So with having that kind of background of just loving just science and math in general, it's not a bad profession to get into because you do utilize some of these aspects that you've learned through your life.
And huge job opportunities, are there not? Aren't there lots of jobs available for pharmacists in this day and age?
There are. So one of the things that they have noticed and one of the trends that they've pulled up was that with pharmacy schools in general, I mean, there's quite a few pharmacy schools. In the state of Ohio alone, we're looking at about 7 pharmacy schools right now.
Oh.
So it led to, when all of these schools came up, it led to a slight surge of students coming through. So we had a lot of overpopulation of pharmacists. But a big thing is due to the pandemic, for example, with COVID and everything else, a lot of things have shifted and changed. So work conditions for a lot of people have changed. The need for having more pharmacists on healthcare teams has increased. So with all of that playing a factor right now, it is still a pretty sought out field because things are starting to, it's kind of, as I jokingly say, it'd be similar to like a housing market, how you have your ups and downs going on with it. Same thing going on. So pharmacy was kind of on a dip all of a sudden because we had so many pharmacists, but now it's becoming an issue where we can't even get enough pharmacists to cover certain places. So they're trying to find ways to like incentivize and get more people to come into the field. So I always say there's a lot of opportunity to go different avenues, different places.
Yeah, I bet.
So,
I bet you could go into a hospital or a pharmacy or a drugstore or a, all right.
Yeah.
Well, I want to talk about specifically drug interactions.
Yeah.
And let's talk about, so I want to cover drug, food, drug, prescription supplements, all of that sort of stuff.
Yeah.
So let's start with this. Are there any drugs that you absolutely should not take together?
So it's a very broad question because
know.
there's quite a few different classes of medicines and things that are out there for the most part. One of the big ones that at least personally that I normally see that comes across the map is a lot of your medications that people will use for things, say depression and anxiety. One of the biggest problems with that is that there's a lot of medications that will do similar things. For example, Cymbalta would be very similar to Celexa. So if you ever hear these drugs kind of going together, they all function a little different in regards to how they work to help you in regards to your depression or anxiety. But the problem with it is that sometimes certain medications will almost duplicate the effect. So what it's not going to do, I guess, more for you than per se if you were to take the medication by itself. The only problem is it increases the likelihood of having side effects with those. So we have to be very cautious, and this is where, say, like a pharmacist would kind of step in to say something to maybe your doctor to say, hey, like we don't want you to have too many medications treating the same thing because it's not going to do you any better. Sometimes it'll actually just increase the likelihood of having some problems with it.
Let me interrupt you.
Yeah.
That is very interesting to me because you see advertisements on TV now for additional, your depression drug is not working, now take this one in addition to the one that you were taking. Or take this for anxiety if you also have anxiety with your depression. And so maybe physicians are not necessarily thinking in terms of interactions, or they think that it will help, huh?
So it becomes kind of a fickle thing. So one of the things that I always love to say is I absolutely loved all physicians. I went to school with a bunch of them that are out in practice right now, and there are a lot of really good people out there. The problem is, and this is kind of where some of the issues lie for us when we're trying to figure out what's working for you, is that you have multiple doctors that do different things. So for a lot of people, you have your general practitioner or family care doctor, so your family medicine practice, and they cover a little bit of your basic things. So I always love to say as a community pharmacist, I'm kind of like a family physician in that regards because I'm meant to be a jack of all trades. I'm not specialized in one particular area, so I'm not specialized in cancer therapy. I'm not specialized in, being like a therapist or a psychologist. But you also have specialists that will focus on, say, your diabetes, or you have a specialist that focuses on your depression, anxiety. The problem with it is that sometimes they don't get the whole picture if you're not completely clear with it. So if you're missing, say, certain medications that you may be on, your specialist may not think anything of it even though your family doctor has you on it. So you have to be very careful because sometimes they're not getting the whole picture. And even if they work in the same healthcare system, there can be mess-ups with information because that's all no different than anything else. It's no different than putting it on a computer and trying to figure it all out. So it's one of the things that I always stress to everybody is that even if you don't always feel the most comfortable with it, be honest with everything that you're on, because that's the best way for a physician or for your pharmacist to really understand. One of the other big issues that we run into is that sometimes we may come up with if you come in for, say, a cold and flu situation, if you don't say go to my pharmacy, I actually don't always have a clear-cut picture if you're not telling me everything that you're actually on. So I always say, as a pharmacist, our goal is not to necessarily antagonize you with questions. Our goal is ultimately to ask the right questions to make sure that we're getting you the right therapy that's not going to do any additional harm. So with that, you always have to be careful because the purpose of some of the drug companies out there is they do these advertisements that you see on TV, just like you mentioned, where you could be using medications for depression, anxiety, high blood pressure, heart failure. And they always throw out these advertisements, but the caveat behind them is that they're not always the best fit for you. So I always say that's why they always end with those statements of ask your doctor. And that's a big thing where they're kind of not necessarily pushing you towards it, but they're having you start the conversation to see if you may go on their medications. I always say, as a pharmacist, my goal at the end of the day is to ensure that you're actually getting off of medications. It sounds weird because a lot of people normally use that stigma of pill pusher. Pharmacists really aren't that anymore. It was an old term from way back when, but the biggest thing about it is my goal is, personally speaking, if I have patients that say are on high blood pressure medicine and they make dietary and exercise changes and they don't fill that medication anymore, that is a win to me because that means you are doing better for your general health. I don't want you to have to be on, 5, 10, 15. I've had people as high as 30 medications before.
Oh my God.
And it becomes overwhelming for one person to deal with that.
Especially as they get older.
Exactly. And that's one of the biggest issues that I deal with too is I'll have patients that'll come in and they will mess up taking their medications because sometimes
that happened in my family with my father.
Yeah. And I always sympathize because the reality is when you have to even as an experiment through pharmacy school, one of the things they had us do was we literally had to fill a pill box with candy. And the idea behind it was that you had different candy for different types to represent different medications. And even for my class, from my standpoint, it was difficult for most of us to even focus on just 1 to 2 medications or even 3 medications at that time. Being on 5 different medications, that's asking for just a can of worms to backfire.
I cannot agree with you more. Yeah. I absolutely will. We will talk about that in a bit, I hope. I can already tell that I'm going to need to have further conversations with you about, let's talk about, other things you cannot take together. I've heard about blood thinners and NSAIDs, Motrin and so on. Tylenol, and then Tylenol PM, and then maybe a cold medicine that contains acetaminophen. So talk about those kinds of things.
So one of the big ones that we always have to be careful about, and you did mention it, is blood thinners and NSAIDs. So your NSAIDs would be classified as ibuprofen, Motrin. There's ones that are prescription-based, like meloxicam. The big one's the Celebrex that some people know a lot about.
A lot of people take that.
So with those medications, the biggest issue that we run into with blood thinners is that the purpose of a blood thinner is normally to help it make it so that your blood thins out a bit more. The reason could be for multiple reasons. So heart failure is one of the biggest ones.
Right.
If you've had a heart attack or stroke, sometimes those clots that can occur, if they go internal, they can lead to serious issues, which could potentially lead to further heart attacks in the future. It could lead to pulmonary embolisms, which are very risky for your lungs. So when you add in an NSAID, NSAIDs actually thin the blood further. Now, for somebody that's on heart failure, you would think, oh, maybe it's not too bad. The problem with it is, say you were outside and you fell, or say you accidentally cut yourself like opening a box or doing something. There's always the potential that depending on how severe you cut yourself, you could just keep bleeding, which is why it's a very big concern. Because your body only has so much blood in it at any time that if you start losing too much of it, it can be very serious. And as they term it, as you get older, it's kind of funny because when you're a kid and when you're a toddler, if you fall on your butt, it's not the end of the world. You get right back up and you keep moving. But as you get older, so if you're getting into, say, your 70s, 80s, 90s, a fall is extremely high risk because not only are you going to hurt yourself or cut yourself, but you can also cause breakages in bones. You can lead to like different lacerations. If you hit your head just right, it can cause some serious trauma there.
Right.
So with that being the case, we have to be very cautious. So for a lot of those patients, our recommendation is if you're on blood thinners, the best thing you can possibly use is actually Tylenol for pain relief.
Okay.
It may not work in the same manner, which is the hard part because NSAIDs normally are used for inflammation.
Right.
So the biggest thing with that is inflammation's common in a lot of bumps, bruises, things like that. Or if you have serious issues that come up with, say, like a clot or something like that, we want to make sure that we're getting you something effective to stop that from occurring. So Tylenol typically works the best, and I always say for anybody that's ever curious, Tylenol is actually your best bet for pain purposes and for fevers. That's why you'll normally see it in a lot of your cough and cold medications, like you said there. So.
But isn't there a milligram sort of end point for Tylenol? I thought there was a concern that people were taking a handful or 3 or 4 every 4 hours and then not realizing that it was also in their cough or cold medicine.
Yes, so one of the biggest issues, Tylenol is very common for over-the-counters because a lot of people typically use it.
Yes.
The cutoff point actually varies depending on what type of Tylenol you use. So the amount that you can use in a day is, we base everything off of milligrams and grams.
Right.
So with that being the case, one of the best ways to break it up is that there's actually 3 different types of Tylenol that exist out there that you'll commonly see. There's regular Tylenol, which is 325 milligrams for each tablet that you take. There's extra strength, which is 500 milligrams. And then there's arthritis strength, which is, and that's actually 650. So it's essentially if you took 2 of your regular Tylenol and put it into 1 pill, you get that. So with that being the case, the normal cutoff for most people we would recommend is no more than 4 grams in a day for a person.
Oh, that's a lot.
It is a lot. And the thing about it is as you get older, we do get a little bit more cautious with it. So at certain points, we want to cut that down. But it's funny that you mentioned that one because it does come back to blood thinners once again. So one of the big ones that a lot of people would be on is warfarin. Warfarin's very common. It's great because it's a very cheap medication. It's been around since the 50s. And the biggest thing is some people may think of it as rat poison, but in very low doses, they use it as a blood thinner. That's how they kind of figured out what it was doing and how to use it beneficially.
Oh my.
But the main thing is if you are on any form of warfarin, you cannot exceed 2 grams of Tylenol. And the reason being is that once you go above that 2 grams, it actually starts interfering with the way that warfarin is supposed to work, that it actually makes the concentrations go up, that you actually might have more in your body than what you are actually intending. So 2 grams isn't a lot. And like you said, a lot of cough and cold medications will normally include it because it's used as a fever breaker. So it's meant to help bring that down. So I always tell people, if you're ever unsure about it, always check the boxes and the packaging that a lot of your stuff comes in. there's always, the main active ingredients will always be individually separated out from the inactive stuff, which is normally used to make the medicine or to say color it. So sometimes you'll get a red tablet or green tablet. That's all on the inactive portion, but the main active portion is where you're going to find everything that's listed that could potentially cause any issues there. So check the box, check the packaging, because certain medications like chlorocidin, which is normally used for cough and colds and things like that for people with high blood pressure, one form of it does contain Tylenol, but another form of it does not actually, and it's more of like almost like a Mucinex. And I always say with cough and cold medications, just be wary, because I jokingly, and I learned this from a pharmacist a long time ago, which was funny. If you look down your cough and cold aisle, if you take approximately 6 different ingredients and mix and match it in different ways, that is literally the entire aisle for you. So it's incredible what you start to notice when you start paying attention or reading and looking into that stuff there.
Yes, cough, and people abuse cough and cold medicine. I don't mean addicting abuse, but just taking more than they should, or they can't. My husband is a great one for taking cough medicine until the cough stops. Yeah. And I don't think he's really thinking in terms of the actual dosing.
Yes.
What if we take statins? What are the things that we need to be aware of? And then I want to say antibiotics. What do we need to be aware of with both those types of drugs? Very common.
So statins, commonly used typically for cholesterol purposes.
Right.
They are our standard, actually our first and second line therapy for helping to reduce cholesterol. The big thing with statin medications, and this is very common that sometimes comes up, is you can deal with different types of muscle achiness, for example. So one of the biggest things is that for some people, when they first start taking a statin, we don't necessarily want to hit you with a high-end statin. So we're talking, for example, Lipitor, 40 or 80 milligrams is considered high dose, or Crestor is another big one that I normally see where that's considered high dose therapy. The only times that we really focus on that type of stuff is normally if you've had a heart attack. Like, we want to make sure you're keeping your levels down. We don't want a recurrent event. We don't want you to have to go right back to the emergency room or have something severe happen. The problem with those medications is at higher doses, people start to notice some general muscle achiness, because the way that the medication works, it does cause a little bit of muscle breakdown to occur in different parts. Now, it becomes concerning for some people if we're looking at, for example, if it feels like, I've had 1 or 2 patients where they said they physically felt like they couldn't move their arms. That's a very big concern, because that's too much muscle breakdown that's occurring. And so whenever that occurs, that's an immediate phone call to the physician to say, hey, this patient's dealing with this. We may want to either completely take them off the medication or reduce the dose down to something way more manageable. So for an atorvastatin, we can go down as low as 10 milligrams. So we may want to start there and see how they do with it. But this is where sometimes herbal medications come into play. So one of the big ones that I always tell people about, and this is if you are dealing with any of the muscle achiness or pains, is that, once again, I don't want to add more medications to the mix, but in this particular case, a CoQ10 is very common. And the nice thing about CoQ10 is it helps to stop that muscle breakdown from occurring. Believe me, it does wonders. Even my stepdad, when he was on his cholesterol medicine, he was having the muscle achiness because he was still working. I told him take the CoQ10. I told him to shift the medication to nighttime because for some people,
that's a good idea.
Yeah, so your highest cholesterol production actually occurs when you're sleeping, and a lot of people don't realize that. So it's not when you're eating throughout the day. It's when your body's at rest that your body's producing the highest amount of cholesterol. So with that being the case, if you take it towards nighttime when it's the most concentrated with your medication, since you're taking it at that point, it does help to reduce your numbers more, is what some people have found. Some medications can be taken throughout, and this is where it could be a literal entire conversation all about statin medications if we wanted to go that far. But certain statin meds can actually be used all day long. For example, Lipitor is an all-day medication, so you could use it in the morning if it's the most easiest for you. But once again, a lot of your other ones, they typically have to be done at nighttime to be effective.
Can you take Lipitor, for example, and CoQ10 at the same time at night?
You could. So that way you're kind of counteracting the side effects from it. But it does work wonders. And like my stepdad, for example, like literally he said he noticed a world of difference when he switched it to nighttime and took the CoQ10. Like he did not have that muscle achiness anymore.
That is an excellent thing to know, because I know that I hear that people don't want to have their dose increased because they said, oh, my back and my shoulders hurt so badly.
Yep, and that's a big thing that, like, you're once again, like I said, we don't want to add more into the mix. So that's sometimes why your physician may not jump the gun for it. But I always recommend it because CoQ10 is a fairly safe herbal.
Yes.
It doesn't interact with most things. The only thing that I ever tell people about is, once again, blood thinners is a big one with a lot of your herbal medicines that we just, if you are on things like warfarin, please let your physician know that's monitoring it, because that may change
What
your
your
numbers.
supplements are.
Exactly, because those do shift it. So,
Chris, we have 4 minutes. I would love to continue this show. Do you have time to do so?
yeah, absolutely.
I am going to conclude this episode of North of 60 with Chris, but stay tuned because I have so much more to ask, and I think you're going to enjoy listening to more of this very interesting topic. So thank you for watching, and stay tuned.